childhood. I have given it in 3 phases: childhood, adulthood, and during the illness. So primary extrovert, soft spoken, obedient, affectionate, sympathetic, never hurts anyone, and she used to love pet animals, having good relations with everybody, and she loves to do work at home like cooking, serving others. She felt good after appreciation, and she liked pet animals. In adulthood, it was more of a fastidiousness, keep the things neat and clean. If the clothes are torn, it's okay, but then they still should be clean, was her motto of life. Very hard worker. At in-laws family, there were a lot of problems, and she had very disturbed marriage life, but then she managed. And when asked to husband, what are the problems you face in life? So he said, she's suspicious, and he was a policeman with all the duties outside and transfers and everything. So she was very suspicious. That was reason for quarrels. Fear of doctors and hospitals, right from the beginning. Injustice, cannot support and likes pet animals. Very sympathetic, friendly, anxious about family, caring for everybody, like trees and plantation, religious since childhood. Now, there was a sea change in illness. Irritable 3+, quarrelsome, contradiction intolerant, conscientious. She said, better than spending 40 to 50 lakhs on my liver transplantation, give it to some other relatives' daughter's marriage, because they are very poor. She was very conscientious about it. On observation, she was very ugly. Means if somebody sees it, they will get threatened, dar jayenge. They will have a fear of her. So now here comes the importance of miasms. See, in treating such diseases, if we get a right approach, Dr. Shinde sir already told it, Dr. Vishpala madam already told it, if we do not have a right approach, no medicine is going to help you. Maybe you have all the remedies similar to me or similar to all the stalwarts, but if approach is right, then only medicines are going to help. Homeopathic medicines do not cure. The principle behind it cures. So try to apply this principle rightly. Master Hahnemann declared in Introduction to Chronic Disease that his most important discovery was not the discovery of homeopathy. At the birth anniversary, I hope this is the right time to discuss. Dr. Hahnemann said, my most important discovery is not discovery of homeopathy, it is discovery of miasms. And sadly, surprisingly, some homeopaths do not consider the miasm to be important. I don't know how it's possible. Scientific Hahnemannian homeopathy can't exist without miasm, and we need to understand it very, very strongly. Miasms are important. If we say we follow Hahnemann, we have to follow miasms, right? So miasmal diagnosis, to know the miasm, we should understand a nosological disease. Definitely, we should know the disease to understand the miasm. Atrophy was there, cirrhosis, encephalopathy, splenomegaly. First is syphilitic, splenomegaly is enlargement, psychotic, compensatory ascites, again psychotic adjustment of the body, chronic liver disease. So the final presenting, the advancing miasm was syphilitic, right? So if the miasm is syphilitic, you cannot go for psoric or psychotic rubrics. For example, if a train gets out of control, you cannot stop that train from a third bogie or a fifth bogie or a second bogie. You have to stop that train from the front engine only. If you stop it from anywhere, it will go faster and patient will die. So syphilitic rubrics have to be an importance. Let me take a step back of treating the causes. Causes are lifestyle, diet and regimen, very important. Miasm most important when present, and maintaining causes, remove first if exist. I have already discussed this. Now miasms are the most important causes, and homeopathy only has a divine advantage of treating miasms. Still, many homeopaths fail to give consistent results, and this is of not considering miasms. Let us see what Dr. Hahnemann directed us. It is something which I am telling, or it is something which Dr. Hahnemann already told. Let us see. Now this part is the most interesting part of today's presentation. The basic type of chronic disease, artificial chronic disease, as given in Aphorism 74. And see, Dr. Hahnemann has given all these things and a different treatment for everything. What do we usually do? We have a same approach for all the cases, whether it is an artificial chronic disease or inappropriate named chronic disease or true natural chronic disease. And second is the most interesting one. This is what I call, or what Dr. Hahnemann calls, it as a chronic indispositions, right? Let us see with the aphorisms. Case 1 was a complex of two natural chronic diseases. Also you have seen drug involvement was there, artificial chronic diseases. So these two things were involved, and if I fail to have a different approach for both of these, I will fail in this case. In aphorism number 77, those diseases are inappropriately named chronic, which persons incur or get who expose themselves continually to avoidable noxious influences. My dear friends, please, 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 this is most important thing. What we do, patient of anemia comes, I do the case taking, give the best of the simillimum, anemia, hemoglobin 6, and the diet is absolutely devoid of iron. Do you really think the best selected simillimum will start preparing hemoglobin from carbohydrates? It won't, and this Dr. Hahnemann already told. So Dr. Hahnemann made it a complete science. We made it a medicine science. कि कोई भी patient है, any patient comes, you have to take a case taking, you have to give a medicine. No, it is not like that, as told by Dr. Hahnemann. So inappropriately named chronic, why they happen? They expose themselves continually to avoidable noxious influences, some habits, some dissipations, some prolonged abstinence from things that are necessary for the support of life. Maybe he is talking of something like vitamins, maybe something he is talking of proteins, maybe something necessary for the existence of life. Avoidance of these things can be dangerous. Look at the diet and regimen. Dr. Hahnemann have written lots of pages on diet and regimen. We don't focus. And who reside in unhealthy localities? Do we really ever ask for where they live? Maybe asthmatic living in marshy district, you give anything, it is going to be difficult. There are remedies given for those who living in marshy district. They will relieve, 100% relief, but again recur because the maintaining cause is there. And Dr. Hahnemann already told, remove maintaining causes first, then comes medicine, not first. Then another, the continuation is more interesting. Who are deprived of exercise or of open air. Who are deprived of exercise. Few diseases happen only because of lack of exercise, and almost all the lifestyle disorders and non-communicable diseases happen due to these things. Lack of exercise and then lack of open air. Today's, especially in Bombay, Delhi, so crowded localities, they don't get open air at all. We can spend only 1 second on telling, go to walk in open air. That's all. That will solve so many of the problems. And this is again said by Hahnemann, who ruin their health by overexertion of body and mind, who live in a constant state of worry, etc., etc., etc. These states of ill health means, I will read it in my way, these chronic diseases disappear spontaneously provided no chronic miasm lurks in the body under an improved mode of living. This was the reason Dr. Hahnemann stressed too much on diet and regimen, diet and regimen. He already told in aphorisms also, ki in case taking, inquire for diet and regimen. We usually do for emotions, 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 right? And if you go to the details of aphorism number 5, he never mentioned take emotions. He said take intellect, he said take will, he never said take emotions. We take emotions. We are so emotional. Under an improved mode of living. So aphorism 7, now as in disease, again coming up, now as in disease from which no manifest exciting or maintaining cause has to be removed, because if it has to be removed, remove it first before forming a totality. So treating from the roots, what do you mean treating from the roots? It is very famous, homeopathy treat from the roots, others treat as a control. So what do you exactly mean is take care of his physical inactivity. If it is there, because exercise and activeness is needed, a necessary element of life, focus on that. If there is smoking, chalo, I am asthmatic and I am smoking and I am taking medicines from Dr. Shinde sir, suppose. Sir is trying best, I am smoking best. Results? Yes, but then we recognize, somehow we recognize smoking as bad, alcohol as bad, but exercise, lack of open air, it is equally or more dangerous. Focus on all the aspects, because homeopathy is not a system to give medicine. It is a system. It is complete therapeutic science. and if applied, will never ever need any other help, right? So diabetes, cancer, chronic lung diseases, all other lifestyle disorders will be treated well if these are taken care of well. As another, I will take this further. I want to stress it, what Dr. Hahnemann told in aphorism. I cannot unfortunately unfold whole aphorism here, but then few important things definitely can be focused. In aphorism 208, the age of patient, his mode of living and diet. My dear friends, how many of us really focus? His mode of living, his diet. We need to, because we are true followers of Dr. Hahnemann. Aren't we? No? I will ask this question again. Aren't we the true followers of Hahnemann? Birth anniversary, itna awaaz sirf. Aren't we the true followers of Hahnemann? Yes. Now this is better. Acha, haan, yes. So his mode of living and diet in order, see, why we need to take this diet and regimen? In order to ascertain whether these things have tended to increase his malady. See whether these things have tended to increase the malady, or in how far they may favor or hinder the treatment. These factors may cause the malady, may hinder the treatment, may act as a maintaining factor and spoil your hard efforts in finding simlimum. Okay? So, in the like manner, the state of his disposition and mind to learn whether that present any obstacle to treatment. See, the problems in mind, the presence of some maintaining causes at home can also hinder the treatment. Focus on all. It doesn't take time. It seems to take time initially, but it doesn't take time. After treatment or request to be directed, encouraged or modified. They may require to be directed. So you are requested or you are instructed by Dr. Hahnemann to direct mode of living, instruct something, encourage. Again in 228 aphorism, he says, mental diseases may result from faults of education, bad practices, corrupt morals, neglect of mind, superstition, ignorance. It will diminish and be improved by sensible, friendly exhortation. Find some time for patient. My dear friends, I already told, medicine doesn't help or medicine doesn't cure unless the principles are followed. And principles are given by master. Follow masterly principles. Follow what master wants us to follow. So it will diminish and be improved by sensible, friendly exhortations, consolatory arguments, serious representations and sensible advice. There is a meaning to every word I can tell, but this is not the right forum of teaching organ, so I am just leaving it stimulated so that you can read it further. Again in aphorism 226, only such emotional diseases subsequently kept up by mind itself, they can be treated by means of psychical remedies. Psychical remedies. What do you mean by psychical remedies? It is not like stramonium, psychiatric remedies. No. Psychical remedies. What are psychical remedies? Such as a display of confidence. You just say, "Aap theek ho jaoge," you will be all right. It have a lot of effect on the patient, better than giving medicine. Friendly exhortation, sensible advice, and often by well-disguised deception, be deceptive if needed. Patient asks, "Kitne din bache? How many days I am going to live?" And if you say, "Doctor told only 1 month," forget it, dear. You can be deceptive with the patient, not with the relatives, but for the patient you can be by slightly deceptive. Disguised deception, be rapidly changed into a healthy state. With the psychiatric remedy, with the psychical remedies, such emotional diseases with a well-guided deception will be rapidly changed into a healthy state, and with appropriate diet and regimen. What is this? Appropriate. Dr. Hahnemann already stressing in so many aphorisms. But the problem is, organon have not been read, still less understood, and still lesser applied. This is the problem. So, just Vishpala Madam already said, we need to upgrade, we need to learn. So, learn organon, learn the master, learn the miasm. Back to case. Already told the case, this is a short analysis. I know everybody knows analysis, so I will skip this faster. Affectionate, sympathetic, care for family, love for family, loves animals, nature, comprehension, easy, suspicious, and benevolence, obedient, conscientious, primary extrovert, sensitive, rudeness, responsibility, taking too seriously, fastidious, and so many of things. Then we do the miasmatic analysis. Yes, it has to be done because absolutely syphilitic illness, you have to be very cautious about the psychotic things. Don't take them. It will do more harm than benefit. So, this is syphilis, SORA may help, or syphilis may help in this case because it is syphilitic and some innate characters may help. Which symptom to be taken? Shall I repetize all these symptoms? Maybe there are 20. No. Again, this is not homeopathy. If you repetize all the symptoms, taking 20 or 30 symptoms, everybody will get this, and finally will land up into getting something like sulfur, lycopodium, calcareas, lachesis, only 4 or 5 remedies in front always, right? Don't take like that. So, go to the miasm for a reference. Miasm will be vital here. It is a syphilitic case, take syphilitic rubrics, not SORA or psychosis. So, final rubrics taken: hunger aggravated, dreams of dead bodies, desire for hot food, and it is boiling hot. What she told, ki I want a chapati which is taken from a gas burner into my mouth. Yeah, I would prefer that. From a gas, it has to be directly put into my mouth, will be my preferred hot food. So, then obviously it was not warm, it was hotter than the warm. So, we can't take something like warm food aggravates, no. What is a desire for warm food? So, it becomes syphilitic, isn't it? Desires are usually psychotic, but such type of desires are absolutely syphilitic. And the drug single chelidonium. Drug doesn't matter, how it came matters. Everybody must have given chelidonium in some kind of liver disease always, isn't it? Isn't it? But then it won't help. Let me just give you an example. I am invited here, coming from the front door, and then got a room here to stay. I am invited by right approach. Suppose I break into that room from a window, breaking window and all, then the constitution of these organizers will throw me out. Similar thing happens when the medicines are selected by a right approach. Single dose works like a magic. No need of repetition. So, chelidonium most of the one have given, everybody have given, but given repeatedly, given on the basis of pathology, it will not work always. This was given on the basis of constitutional simillimum and given as a single dose of 30. So, absolutely, this patient, 200, yes. 200 was given because there was lot of irritability, anger, and absolutely syphilitic anger, and she said, me, if doctor do not bring food for me. So, it was such a heightened anger. So, selected was 200. So, and then lot of dynamism was there. So, patient was admitted in a hospital. So, almost I have hourly follow up, but then I have given salient features here. Only importance mentioned. After 6 hours, drowsiness was reduced, toxicity of face was reduced, hunger in better control, love of life. She said, initially she said, kill me by giving something. Now she says, love of life, mujhe theek kar do, mujhe jeena hai, I want to live. Abdominal girth started reducing. The follow-up after 12 hours was, she was better yesterday, hopeful of recovery. No dreams of dead bodies, syphilis should go first. Dreams of dead bodies was obviously syphilitic, that has to go, it went away, walked with support. Just 5 minutes. After 12 days, this is an interesting turn. Now, chelidonium single dose will cure everything, may not be always possible. There was a fever. After 12 hours, there was a fever. 102, 103. It was a welcome sign because patient was already in fever. Lot of suppression, but then there was started a verbal loquacity and delirious. Then this again was syphilitic. So, I thought I need to give it a dose. I gave with the totality. Patient was in septicemia. TLC came to 20,700. Patient told, sir, antibiotic फिर से देना पड़ेगा. मतलब just give me 12 hours before giving antibiotic. I gave pyrogen 1 dose, 200, and fever started reducing very next day. Patient was afebrile on 5th day, and chelidonium 200, 1 dose was repeated again. I am telling you exactly what I did, right? And then reports, okay, you have to, this is 7,000, TLC is 7,000, and bilirubin is somewhere 5.7 here. And the most interesting thing again happened, another twist. Patient complained of epigastric swelling. Sir, there is a big lump here. And they called their gastroenterologist, they said, cirrhosis often turns into malignancy. So, cancer ho sakta hai. It can be a malignant lump. They immediately came to me, sir, ab kya kare? The doctor was saying, you took homeopathy and therefore this happened. Well, let me see. Let me call Dr. Henneman for miasms. So ultrasonography abdomen shows lump, so decided to MRI abdomen, and MRI told me something very important. So there is a significant atrophy of right lobe. Right lobe was gone completely. It was initially also atrophied, but now it is severely atrophied, gone completely. But some interesting thing was there. Left lobe of liver is significantly enlarged. Compensatory hypertrophy. It started occurring, and then chronic liver parenchyma disease with severe atrophy too there was. So this is more prominent. I have mentioned it for you as well. So MRI, significant atrophy of right lobe, compensatory hypertrophy of left lobe, calcified granuloma in segment 8 of liver. Now this is compensatory hypertrophy. What to do? Wait or change a remedy? Yes, we were coming from syphilis to psychosis. I asked them to wait for few more days because bilirubin, OTPT, everything was reducing and patient was absolutely fine. Walking, talking, doing all normal activities. So there was reversal of miasm, destructive to constructive, and reports were normal. I won't show it again, and this miracle happened. Liver is normal in size and shows uniform echogenicity with no evidence of any diffuse lesion. Completely atrophied liver as per all the reports and scans and MRI. Now stated normal liver. Yes. It is almost after 1 to 1.5 years. I have all the dates, but the time is not permitting. But it's almost 1.5 years. Liver is absolutely normal, no atrophy. Liver is normal in size with uniform echogenicity with no evidence of any focal or diffuse lesion. Completely cirrhotic liver, completely atrophied liver can recover to such an extent. Same thing can be done in all kind of lifestyle disorders. Anything can be reversed with right simillimum and right approach. The only thing is right approach as per Dr. Henneman. Not as per, because every homeopath has its own approach and everybody is right. Isn't it? Vishpala madam ने बहुत अच्छा एक sentence बोला कि everybody is a master in homeopathy. So that is the biggest problem. Thank God I am a student. This case beautifully illustrates the superior efficacy of homeopathy in critically ill patients. Patient is enjoying new lease of life given by scientific homeopathy, and gastroenterologists are astonished. She went to gastroenterologist, sir, आपने बोला था I am going to die. You said I am going to die. Here I am. Doctor was shocked. How can you? And then he said, you better go to the same homeopath because he knows you better. It was a great gesture from a gastroenterologist. Nobody ever does it. So he sent the patient back to me, said, you just go there, you don't go anywhere else. And then a simple case, I will finish these cases within a minute. Liver cirrhosis with leading to recurrent complications. So I told 3 varieties of any chronic disease affecting as a fatal complication, as a recurrent problem. So this is a case where cirrhosis present to me as a recurrent complication of hepatic encephalopathy. History is that patient, every 2 to 3 months patient was going to encephalopathy, he was admitted, brought back, again 3 months, again hospitalization. With very simple case, nothing great about it. The only thing is that I will highlight about miasm in this case. He was, the miasm was psychosis and syphilis. So hence innate characters and syphilitic rubrics will be more important. Final rubrics taken as syphilis, gesting psychosis, psychosis innate. Drug was lachesis. 1 dose given, single dose. I always practice in single dose, no repetition unless that constitution tells me, please repeat. Because Dr. Kent have already said, if you repeat it, you are a criminal. I hope everybody read this. It is criminal to repeat a dose unless demanded by the constitution. So I don't prefer to be criminal as far as possible. Result, fantastic. He was never ever hospitalized then. He was never ever hospitalized after that. Case number 3, it is a comorbidity. Liver cirrhosis as a comorbidity. Every lifestyle disorder presents this way, as a comorbidity, as a fatal complication or a recurrent problem. And homeopathy has an answer, but a different answer, different approach in all kind of phases. Here it was a comorbidity, panurethral stricture, liver cirrhosis, portal venous thrombosis, and patient was very sick, and then he was having difficulty to walk, very weak, and obviously difficulty to walk cannot be because of stricture, it was because of cirrhosis and the complications he was getting. So these were the diagnoses from a very famous gastroenterologist at Nagpur. So then there was exhausted appearance, then whole case. I know everybody is expert here in finding the similium. So I am highlighting what else you need to know as instructed by Dr. Henneman, rather than just going for our own approach. Insulin, these were the rubrics taken. This was a drug, nitric acid came. Because of the absolute severe stricture throughout the urethra, I gave 30 potency here. Result was fantastic and patient is very happy. So now when it comes to homeopathy proved its efficacy in all kind of liver cirrhosis or lifestyle disorders or NCDs, when it came as a fatal disease, when it came as a recurrent problem, when it came as a comorbidity. Hence, if the right approach is used, the lifestyle disorder is a new area open to all of us. Treatment of lifestyle disorders. If miasm is there, go for constitutional anti-miasm remedy. Simple. If drugs are there, drugs is the cause, stop the drug or change or modify. Lifestyle, diet or regimen is responsible, change or improvise. As said by Dr. Henneman, follow everything to improvise your results. According to Dr. Henneman, if there is artificial chronic disease, what treatment he has said? What we do? GCS, constitutional similium. No, Dr. Henneman told, stop drugs and let vital force recover on own. These are the words of Dr. Henneman giving an aphorism. May need medicinal help. At times patient may need medicinal help. Give it as a help, not as a primary treatment. Then in aphorism 77, improved mode of living causes spontaneous recovery. Remember that. If you go for a drug, it won't act. In two natural chronic diseases, constitutional anti-miasm remedy. Right? These are different chronic diseases, different type of lifestyle disorders, needs different approach. Don't follow the same approach everywhere. And complex diseases depending on the combinations. So in a nutshell, lifestyle disorders are curable, treatable with right Hennemanian approach. Please, I urge again, don't forget Dr. Henneman. Cirrhosis and many other NCDs are reversible. Follow Henneman, follow Organon. Vishwal Madam already said, just upgrade yourself, keep learning. So I request to all of you, keep learning and understanding and applying Organon. That is homeopathy. Drugs are not homeopathy, metamedic is not homeopathy. Homeopathy is Organon, nothing else. Organon needs to be understood practically, and homeopathy and homeopathic horizon needs to be expanded in incurable diseases. Hence, hats off to the organizers for giving the title as Expanding Horizons in Homeopathy. Homeopaths are the best person to treat lifestyle disorders if properly equipped with knowledge. Homeopathy is the medicine of future. Best luck to all of you. Hail Henneman, hail homeopathy.
Thank you, Dr. Ravi.
Thanks for your intellectual listening. The basic logo for this lecture was Dare to be Wise. And I wish you all happy learning. Thank you.
Thank you, Dr. Ravi. Excellent exposition.
Thank you.
Thank you so much.
Any questions, please?
No time for questions. We're going to go on to the next.
So we have a next very.
But it was very lucid anyways. The
Yeah.
questions are already answered. So
Thank you. Thank you
Thank
all
you
of
so much. Thank you. So we have an excellent speaker ahead. He is not only a speaker, he is a leader,
Thank you, sir.
and he heads Homeocare, a chain of homeopathic pediatric clinics, Dr. Praveen Jain. So he is setting standards how we tackle homeopathic pediatric cases. If I start speaking about him, it will take too long, and we are already short of time. Dr. Saab, your words speak. Please.
I thank the organizers for inviting me here to share my experiences. The topic which I selected is something which is very close to my heart. This is pediatric case taking. Now, what I would like to speak to you is, I'm not here to teach you anything, but I'm just trying to share what practical difficulties I went through when I started my practice. 22 years back when I started my practice, there were a lot of difficulties, a lot of problems. As we are all aware that most of the practice, almost 40% of our practice is a pediatric practice, and I had a lot of challenges when I was seeing those pediatric cases. More so, the problem was pronounced when I had my own child, and I share this experience in wherever I go. And when it was my turn to find the remedy for my own child, sitting across the table and asking your patients, asking the mother that tell me nature of your child is very important. But the same difficulty was pronounced when I faced with the problem of finding the remedy for my own child. Here, I could not ask my wife, tell me the nature, because she countered this by saying, you are the father, you know the nature of the child better. Imagine I had in front of my eyes a 3-month-old child. I'm struggling to find the remedy and no one there to help. Sitting across the table, it is very easy to tell कि अगर आपने अपने नेचर नहीं बताया आपने तो फिर दवाई कैसे ढूंढूंगा मैं आपका. But the same question when it came to me, my own child, I was struggling to find the nature, what to see. Whereas I was fortunate enough to learn with all the stalwarts of homeopathy, Dr. Vijayakar, Dr. Shankar, they all were my teachers, and I used to see them in OPDs, they used to prescribe, like seeing the child, they used to say that this is chamomilla child, this is pulsatilla child, this is arsenic child. I was always wondering why, how can they do this so efficiently, and here I am not able to even understand how to proceed with the case. Forget about finding the remedy. So the challenges in pediatric case taking was that history taking was difficult. Adults, we can ask lots of questions, but in pediatrics, what to ask? So when I went back to my teachers, they said it's very easy to practice. Pediatric practice is one of the most easiest practice to be done. Very easy. Only thing what you require is observation. I said, fine, then take it. The only thing which we require is to have observation. The only challenges was observation, 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 and observation. So I have in front of me a 3-month-old child, and I am looking at her day in and day out, but what to observe? My seniors used to tell me that it's fun to observe the child and it's fun to prescribe. बहुत मजा आता है pediatric practice करने में. And most of the practitioners who are there, they know pediatric practice is very good fun because there is no masking of symptom. It is WSWIG. What you see is what you get. What you see is the right picture. So observation forms the most important aspect of pediatric case taking. But the question was in front of me that what to observe. क्या देखूं मैं? I struggled, but I could not observe anything. And I was just wondering how my seniors, how my teachers can just see the child and say that this is this remedy. How to interpret your observations.